It's a delight and privilege to catch up with you, Dr. Santosh Moses. Dr. Santosh Moses is the country head for Operation Eyesight Universal India. Santosh, for the last 10 years you've been quite active working on various initiatives across India. What's the main focus of Operation Eyesight Universal?
First of all, thanks Vinod for having me here, and since India Vision Institute is a partner of Operation Eyesight for the last 2 to 3 years, the pleasure is even more. Operation Eyesight is a 52-year-old international development organization. We are headquartered in Calgary in Canada, but we have been working in India since 1963. So we started off by supporting cataract surgeries of a missionary doctor by the name of Dr. Vinod Daniel. He was in a small village called Sompeta in Srikakulam district in north coastal Andhra Pradesh. Since then, Operation Eyesight has evolved significantly, and now we work in 5 countries in Africa and in about 15 states in India. So we work with about 50 eye hospitals across these 15 states in different thematic program areas.
Yeah, and I mean it's great that you're working across India in so many different states and in so many different hospitals. And based on your extensive travel, what's your immediate observation on what the biggest needs are?
Well, India is the what people are calling the blind capital of the world. We have 12 million people who are blind. But what is more touching and shocking is that 133 million people do not have access to a pair of spectacles.
133 million?
133 million Indians. So what we find pressing at this need is to work with the community, empower the community, and provide primary eye care services to most of the population.
And maybe a few examples on what is involved in the primary eye care services?
See, we work in 2 thematic areas. One is community eye health and the other is facility based eye health. So what we do in terms of linking these two is very, very important. So our model is something similar to what Dr. G.N. Rao propagates with L.V. Prasad Eye Institute. So you have the secondary eye hospital at the district level where we strengthen the hospital to provide quality eye care services. So we build the capacities of the hospital team. Going below to the primary eye care level where the need is much greater, we establish vision centers similar to the ones L.V. Prasad Eye Institute have, but with a slightly different twist. The twist is how we integrate our vision centers with the community. So we work with the communities through our community health workers and empower the community to access services at the vision center. So there is a strong link between the community and the vision centers, and this linkage has helped these vision centers improve uptake of services and also make them financially self-sustainable.
Okay. And maybe just to add on to what you're saying, if I may ask a further question, how do you make them sustainable, these vision centers?
See, most of the hospitals we work are secondary level eye care centers, and they are venturing into primary eye care services for the first time. So they are very, very worried what will be the cost burden on them, will these vision centers be financially sustainable. So what we have been able to conceptualize is a slightly different model. So we don't go below the block headquarters level, because what we have seen from our experience in the states where we work is that there is no eye care service facility available at the block level itself. So you don't have an ophthalmologist, and you are only having a few optical shops in those vicinities. So we establish vision centers which look attractive, look like the other optical shops, provide them with high quality equipment, slit lamp, an applanation tonometer, a fundus camera, and make them look very attractive in terms of the display of the spectacles, the racks, the showcases. We encourage our partners to charge for the OPD. So they charge a small fee of about 20 rupees and then have whole range of spectacles starting from about 100 to about 2000 rupees. So with these vision centers seeing between 10 to 15 patients a day and selling about 3 to 4 glasses a day, they are able to cover the cost pertaining to the vision center.
I think that's fantastic. One final question, based on your experience having worked for the last 10 years, looking at the needs in a ground level, what do you think India needs to do in the immediate short term to meet this urgent need of servicing 13 crore people?
Right. Now, what we have found in our experience, especially in rural areas, is there is a tremendous shortage of manpower. Human resources is a big need, and all of us are aware that we need so much more of all cadres of staff, and that is something we are working extensively with our partners. The government is also partnering with us. We are partnering with institutions such as India Vision Institute to enhance the quality and cadre of paramedical ophthalmic professionals, doctors, eye care managers, and community eye health professionals. In terms of primary eye care, I keep going back to it because the figure of 133 million is entrenched in my brain. We need 20,000 vision centers by 2020. And currently, with the government, with all the partners and major NGOs in the country, we have only about 3,500 vision centers to date. So we have another 4 years to build capacities as well as establish these vision centers to meet the need in the community.
Thank you so much for your time. It's great catching up.
Thank you.
Thank you.